What's up, guys? My name is John Hawes, RNCCRN with NRSNG.com, where our goal is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. To help you succeed on this journey, we've created weekly cheat sheets that we send to you every single Friday. To sign up, head over to nrsng.com/freebies. That's nrsng.com/freebies. And every single Friday, we'll send you a cheat sheet on pediatrics, OB, med-surg, mental health, ICU, critical care, every single aspect of nursing care to help you succeed. That's nrsng.com/freebies. All right, now let's roll into the show.
All right, guys, what is up? Welcome to the podcast. Today, I'm going to talk you through how to work through those select all that apply questions in nursing school exams. I'm Katie Kleber, your host today. So, select all that apply. What do I mean when I say that? So, there are questions in nursing school exams. Many are multiple choice, meaning here's the question, your options are A, B, C, and D. But select all that apply, here's your question, here's A, B, C, D, E, F, G, and anywhere from at least 2 to all of them can be correct. And you have to get all of the correct selections or the entire question is wrong. These questions are pretty frustrating for nursing students naturally because it's a much larger question that essentially has the same weight as the other questions, but it takes a lot more work and a lot more knowledge to get it correct. So we created this little bit of a guide, a blog post as well to help you kind of work through these in a systematic way. So when you see them, you don't freak out. You have the confidence that, hey, I can do this. I can handle this. So let's see. I want to first define what the NCSBN defines a select all that apply. They consider it an alternate format question. There are other alternate format questions, but this is the one we're going to focus on. And by definition, they have to have at least 2 of the answers selected for it to be correct. So in other words, you will never get a select all that apply question where only one of the answers is correct. At least 2 will always be correct. So that's something that's helpful to know. Okay, so let's talk about, though, the way that you should really view these questions. So when I was going through nursing school and I would go through my exams and I'm, going through my questions at a relatively consistent pace, and then I'd get to a select all that apply question, and when I didn't get through it at the same pace as I was getting through my multiple choice questions, I started to get frustrated. I started to feel like, I should get this. Why is this taking so long? And then I would kind of mentally check out in the middle. I would sort of like, I'm frustrated that this isn't, I don't just know this right away like I know the other ones. Which, it's a kind of the natural way to look at it, but I wanna give you a different way here to view these questions that will hopefully help you work through this a little better. So, let's give you an example. I want to give you guys one specific example. All right. Here's a question. A 45-year-old heroin overdose patient has been pushed out of the car on the entrance of the emergency room while the getaway car squeals off. Side note, yes, this truly, truly happens. You get this patient on a stretcher and roll them into the resuscitation bay. They are not breathing, they are pale, but they do have a pulse. Which of the following should the nurse prepare for this patient? A, oxygen bag valve mask. B, Narcan. C, suction. D, an intubation box. E, Romazicon. F, a thermometer. G, a crash cart. And H, a rapid infuser. All right, so that's an example of a question. And I would look at that and say, what can I pick out immediately? And then if I wasn't sure, or if I didn't get that as fast as the other multiple choice, I'd get pretty frustrated. But the thing is, though, is that's not just one multiple choice question. It is 7, right? 2, 4, 6, 7 true false questions. So that's how you need to look at these questions, that they're not a normal multiple choice question. They are anywhere from 4 to 7 true or false questions. So what do I mean when I say that? So this is the heroin overdose patient. So you want to turn each option into a true or false answer. So, okay, let's go through this one. A heroin overdose patient presenting to the ER should have an oxygen bag mouth mask present upon arrival. True or false? True. A 45-year-old heroin overdose patient should have Narcan available upon arrival. True. A 45-year-old heroin overdose patient should have suction set up when they arrive. True or false? True. A heroin overdose patient should be pushed, or not should be pushed out of the car. Heroin overdose patient should have Romazicon available when they arrive to the resuscitation bay. False. Romazicon isn't going to do anything for a heroin overdose patient. There is no need to get that medication. A 45-year-old heroin overdose patient should have a thermometer available when they get to the resuscitation bay. True. Let's see. A 45-year-old heroin overdose patient should have a crash cart available when they arrive in the resuscitation bay. True. We heard this patient is not breathing. They're not stable. We need to have the crash cart ready. And then finally, 45-year-old heroin overdose patient should have a rapid infuser available at the resuscitation bay. False. So, a drug overdose patient doesn't necessarily mean they need blood products or such a large amount of IV fluids that they need a rapid infuser. We don't have enough information about the patient to definitively say if we need a rapid infuser or not. So if you can see, we went through that question and turned it into a bunch of true-false questions. It's a lot more work, but it helps you systematically work through them. So if you can really change your mental thought process from this is a normal multiple choice question to this is a large amount of true-false questions. Our Susan, who also works with us here at NRSNG, made a really good point. We were talking this out and trying to figure out the best way to explain this. She said that a select all that apply question is like it's like a treasure chest that you open up and there's 7 extra questions in there. Not that you really want to get that treasure chest, I guess. But, it's like you read the question, but you're really getting like anywhere. Well, I don't think I've seen one with more than 7 options, but 4 to 7 options. So it's really 4 to 7 questions. So let me go through a very systematic way for you to really just look at these. And another thing I want to make sure you know too is that, how I was talking about pace earlier. So I would look at the pace that I would answer multiple choice questions, and I would be frustrated with myself that I wouldn't answer the select all that apply at the same pace. So, expect those to take longer. Expect when you see a select all that apply to kind of relax, hang in there, because that bad boy is going to normally take a little longer to get through. And that doesn't mean anything's wrong. That actually means you're doing it correctly. So don't be frustrated by that. Be encouraged by that, okay? Because that's a good sign that that's taking longer. Another thing, too, is I'm a little bit of a slow test taker. And so I would get my test, start taking it, and then inevitably it felt like 70 seconds later, the A+ student in the class would be done. And then people would start to finish, and I would just feel so incompetent, I guess, or not as smart because all these people were getting done faster. And I had talked to them after other exams, and I knew they did just fine. But you know what? If it takes you longer, it takes you longer. You're never going to have a patient that's going to ask you how long it took you to complete nursing school exams, and if you were the fastest or the slowest. Nobody cares about that. So take the time that you need. Don't feel like you need to compete with the others in the class. Really focus on the paper in front of you, or maybe the computer screen in front of you, and as much as you can, block out everyone else. who cares what they think if you're taking too long? Or, just try not to focus on those outward things. Really focus on your knowledge, and the questions that are being asked. And that should be the focus, and try not to get distracted by the other stuff. All right. So let's go through that systematic thing that I was telling you, that I keep promising you. All right. So the first aspect of this is read the question, cover up all the answers, cover up all of them so you don't peek. So this is, hopefully, if you have a piece of paper, if it's on a computer, or if it's an actual test written down, you can do this a lot easier. So cover up the answers and then read the question. Make sure you understand what they're asking you for in the question. You may need to read it one or two times to make sure you fully understand what they're asking you for. Because sometimes they say, what should you have, or what shouldn't you have, or what would you expect, or what would you not expect? So frequently it'd be like a disease process. What do you expect, or what do you not expect? What would you delegate? What would you not delegate? So kind of get your mind thinking about it before you're seeing the options, okay? That way, you're not kind of distracted by, a fleeting, I know this is connected with this, and just kind of go with that when it's like, wait a second, if I would have slowed down, I would have realized that's actually the opposite of what they're asking for. That tripped me up a few times. So, cover up the answers, make sure you understand what they're asking you for, okay? And then uncover the first answer and turn it into that true-false question, okay? And systematically go through each question or each option, making them into a true-false, and only uncovering one at a time, okay? And if you're going through that, and let's say you're on option 5, and option 5, you're like, yeah, that's true. Oh, wait, that made me remember something about maybe option 2 that tells me I did something wrong and I need to change that. Don't go back up and change it yet. Wait till you get through all, who knows how many, 7 options, and then go back through them, okay? So have that systematic way of working through it and finishing your thought process, finishing your true-false changing of the question, and then go through it again. So if you can use that sort of a systematic way of looking at them, and let's go over that one more time. You're going to read the question. First, you're going to cover up the answer. All of those options. When you get to select that all apply, try your best not to look at the answers. Pull up, get a piece of paper, cover up all the answers. Read the question a couple times. Make sure you fully understand what they are asking of you. And get your mind thinking about whatever that may be, even without seeing those answers. And then uncover one answer at a time, turning it into a true or false question and answering it. It's helpful, too, if you write it on the, okay, true, okay, false, right after them. Work through each option one at a time, uncovering as you go. And if while you're doing that, you realize before you answered something incorrectly, don't go back up until you've gone all the way through. Double check your answer and move on. Remember, this should take longer than your multiple choice questions. This should not be answered at the same pace as the multiple choice questions. So just keep that in mind when you're working through these select all that apply questions. They are conquerable. They are doable. If you're taking the NCLEX and you're getting a lot of select all that apply questions, that's good. They're a higher level. That means that you're answering questions so that you actually get to that point. So that's an encouraging sign, but knowing it's encouraging doesn't really help you work through them. So I hope I hope that this little guide has been helpful for you. Go ahead and check out, we have a lot of resources available. We have, one of the best things for NCLEX prep is taking practice questions, getting used to it, getting used to answering select all that apply questions on a screen. That can be a little challenging too. So we have a couple things available. We have what's called the NCLEX, where we kind of simulate the NCLEX so you can go through those questions. We also have nursingpracticequestions.com, which, like I said, the best thing you can do no matter what your study technique is for the NCLEX is just doing practice question after practice question. So we created something that you can use on your desktop, on your phone or your tablet or something. They're available actually as part of our academy that we have just launched, the NRSNG Academy. So if you go to nrsng.com/academy, you can see all the information about it there, but those both are included within that. So I encourage you to check that out and encourage you to get kind of a system down with select all that apply, and then just practice them. Just go through them and get used to that format. That way when you get to the exam, you're not caught off guard or overwhelmed. You are confident and ready to go and bring it on. So thank you guys so much for listening. Stay well.
All right. I hope that was helpful today, guys. I hope that gave you some motivation, some inspiration to go out and to be your best self, to go out and to become the nurse that you want to be, to make a difference, and to do the best work that you can. Listen, we're here to help you along your way. At NRSNG.com, our goal is to give you tools and confidence to help you in nursing school, on the NCLEX, and in life. One of those tools we created is our Friday freebies, these weekly PDF cheat sheets that you can refer to on the clinical floor, in the classroom, and just throughout your entire career as a nurse. To get these cheat sheets, head over to nrsng.com/freebies. That's nrsng.com/freebies. You guys, if you need anything, we're here for you. You can reach out to us on social media or via email at contact@nrsng.com. We want you to succeed. We want to help you along the way. We're here to hold your hand. We're here to give you the tools, the confidence that you need to achieve success in this journey to nurse. All right, so you guys know what time it is now. It's time to go out and be your best self today. Happy nursing.